quick video on how to complete transfer orders and interim admission orders from EntryPoint. I have a test patient here in Meditech, and you can see here third from the top in my list is EntryPoint. And once I double click it to launch, it'll take me to EntryPoint. It will log me in. I'll open two of them, I'll close that one. And it'll contextually include the patient and what you can search. So let's start first. Let me do the transfer. So let me look for transfer, and that will show me Niagara Health patient transfer order sets. The patient demographics are already documented, so I'm going to send the patient to another site, which is G&G. I'm going to send them to Brock unit, and the diagnosis is appendicitis, and patient's full resuscitation. The patient is going by, let's say, non-urgent paramedical transfer, but you can pick other options, whether it's urgent and you can pick if it's a consult or transfer of care. This patient had to be transferred of care to the surgery service. I'm going to put in Dr. Raj Gopal. I could have picked an easier name. Let's create a surgeon came Dr. Rogers, and he was accepted by Dr. Rogers at 1500 p.m. and he's a direct admission. If we have the room number, great. If we don't, that is fine as well. But you can write here Brock, and if they've already given a number, the nurse can write it later. And what else? Notify the charge nurse. All these are selected for you. You probably don't need this because you're going to do interim admission orders. And if you have any other orders here that you want to do, and then you submit, put in my code, submit that. And now it's ready to be printed and put in the patient's record. So I'm not going to select a printer. This goes nowhere, but you can select any of the printers in your department and you print that. So let's go back and do interim admission orders. So the patient is still here at the top. I'm going to select them. I'm going to write interim, and this will bring in adult interim admission orders. And this makes sure that the care of the patient continues and that the patient actually is admitted when they arrive at Brock. You don't need to do this if they go to the emergency department because they'll be seen. So Dr. Rogers, diagnosis is appendicitis, if I'm spelling it correctly, full resuscitation, BPMH to be completed when they arrive there. If you need any keep them NPO after, say, 6 o'clock in the morning, 0600, so they'll be ready for surgery tomorrow. Bed rest, pain scores. Let's do pain scores every 4 hours. Let's do vitals every 8 hours. We don't need any of that. It doesn't need a Foley, oxygen. If there's any other blood work that needs to be done, or by tomorrow, say tomorrow at 600, I want to repeat the patients tomorrow. I want to repeat the CBC, creatinine, and chemistry and lights. No additional labs. The patient already has a CT and chest x-ray if you want to leave that in. So you want to put him on, say, D5W in normal saline, for example, at 100 mils an hour. And you can say, for example, once MPO, so that they don't start it tonight. If you need a diabetes management, something for pain, something for fever, something for pain. And if you're going to do a DVT prophylaxis, and if you do, you just pick that up and it's ready. Everything else is filled out for you. And here you're going to write the patient's regular medications. So I'm going to say ropatidine. This patient takes ropatidine 10 milligrams orally once a day. And they take Ventolin, MDI, 2 puffs every 4 hours as needed. For example, these are the patient's only medications. And now same thing, submit my personal code, and it comes back and it is ready to be printed and place the patient's chart. There you go. You can always find them, of course, in your archives. So I'm going to hit print here.